You are taking vitamin B12, but there is a very high chance your body is not actually using it. Millions of seniors faithfully take their supplements every single morning, yet nearly 40% of people over the age of 60 represent a deficiency that affects their nerves, their energy, and their heart health. The problem is almost never the intent, because you are trying to do the right thing for your health, but the problem is the delivery system inside your body that changes as you age. Taking the pill is completely useless if the vitamin does not get absorbed into your blood to do its job. I'm Dr. Ben Harris, and today I am going to walk you through exactly how to fix this deficiency so you can protect your energy levels and your nerves. Most people focus entirely on the dosage, asking if they should take 500 or 1,000 micrograms, but that is actually the wrong question to ask first. The order matters more than the amount. I will show you why the specific type of B12 you choose and the time of day you take it matters far more for your blood pressure stability and your nerve health than the number on the front of the bottle. We have a lot of ground to cover to get your levels right, so let's get started immediately. The first major reason you might be deficient despite taking a supplement involves your stomach acid. This is something that gets overlooked in standard checkups constantly, yet it is the gatekeeper for your entire nutritional status. We need to look at this through the experience of a patient named Arthur. Arthur was 72 years old when he came to see me, and he was frustrated because he used to be a very active man who spent hours in his garden every morning. Over the last 2 years, he had slowly lost that drive. It wasn't that he was in pain, but he described it as having a battery that wouldn't hold a charge. He would wake up tired, eat breakfast, and feel like he needed a nap by 10 in the morning. He told me he was taking a high-quality multivitamin every day that contained vitamin B12, so he assumed his bases were covered. However, when we looked at his medication list, Arthur was also taking a daily medication for heartburn. He had been on a proton pump inhibitor for about 5 years to manage acid reflux. This was the missing piece of the puzzle that nobody had explained to him. The mistake here was assuming that swallowing a vitamin is the same thing as absorbing a vitamin. In order for your body to extract vitamin B12 from the food you eat, or to break down certain types of tough tablet supplements, your stomach requires a strong, acidic environment. The acid is what separates the B12 from the protein it is attached to, so it can bind to something called intrinsic factor and be absorbed later in the intestines. Arthur was taking a medication specifically designed to lower his stomach acid. While that helped his heartburn, it effectively turned off the mechanism his body needed to process the B12 he was swallowing. The pill was likely passing right through his system, or only a tiny fraction was getting into his blood. This is incredibly common in adults over 60, even if you do not take heartburn medication, because our natural production of stomach acid declines significantly as we age. This condition, often called atrophic gastritis, means the lining of the stomach thins out and produces less acid. The change we made for Arthur was very simple but very specific. We stopped relying on the swallowed tablets that required strong acid to break down. Instead, we switched him to a sublingual form of B12. This is a small lozenge or a liquid dropper that you place under your tongue. When you use a sublingual version, the vitamin absorbs directly into the mucous membranes of the mouth and enters the bloodstream, completely bypassing the stomach environment. It does not matter if your stomach acid is low, and it does not matter if you are taking heartburn medication. The absorption happens before it ever reaches your gut. Within about 3 weeks, Arthur noticed a shift. It wasn't an overnight miracle, but he told me he was able to stay out in the garden until noon without feeling like he needed to collapse. His battery started holding a charge again. This connects directly to your blood pressure management in a way you might not expect. We often talk about salt and exercise for blood pressure, but if you are chronically fatigued from a B12 deficiency, you are not going to move. You are not going to go for that daily walk. Sedentary behavior is one of the fastest ways to stiffen your arteries and raise your blood pressure. By fixing his energy levels, Arthur was able to return to his daily movement, which naturally helped keep his blood pressure readings in a healthier range. Here is how you can apply this to your own routine. If you are over 60, and especially if you take any medication for acid reflux or heartburn, Do not rely on a standard swallowed pill for your B12. Look for a bottle that explicitly says sublingual or dissolvable. You place it under your tongue and let it sit there for at least 30 seconds before swallowing. This gives those blood vessels under the tongue time to pick up the nutrient. It is a small adjustment, but it ensures that what you are buying is actually getting into your system. The second point is arguably the most critical for anyone watching who is managing blood sugar issues. There is a specific interaction between a very common diabetes medication and vitamin B12 that can mimic serious nerve damage. I want to tell you about Sarah. Sarah was 68 years old and she had been managing type 2 diabetes for about 15 years. She was a model patient in many ways. She watched her diet, she kept her appointments, and her blood sugar numbers were generally very stable. However, she came to me because she was scared. She had started developing a tingling sensation in her feet. It started as a mild buzz, like her foot had fallen asleep, but over 6 months it progressed to a numbness that made her feel unsure when she was walking. She was terrified that this was diabetic neuropathy. We know that high blood sugar over many years can damage the nerves, leading to permanent sensation loss. Sarah assumed that despite her best efforts, the diabetes was winning and destroying her nerves. But when we looked at her history, we saw she had been taking metformin for over a decade. Metformin is the most common and effective first-line medication for blood sugar control, and it is a wonderful drug for many people. But it has a well-documented side effect that is frequently not discussed during short doctor visits. Long-term use of metformin interferes with the absorption of vitamin B12 in the lower intestine. The mistake Sarah made was not her fault. She simply didn't know that the medication keeping her sugar down was slowly depleting her B12 reserves. The symptoms of severe B12 deficiency, numbness, tingling, balance issues, and pins and needles sensations look almost exactly like diabetic neuropathy. We tested her levels, and they were critically low. The change we made was immediate. We started her on a high-dose B12 supplement to bypass the blockage caused by the metformin. The improvement was remarkable. The numbness in her feet began to recede. It turned out that her nerves were starving for B12, not being destroyed by sugar. She regained confidence in her walking, and the fear that she was losing her mobility faded away. If you are taking medication for your blood sugar, specifically metformin, you must be aware of this link. It does not mean you should stop the medication. It means you must support your body with the nutrient that the medication depletes. Here's a simple way for us to check in with each other. Comment down below with your age and let me know if you are currently taking metformin or any medication for blood sugar. It is helpful to see how common this situation is in our community. This matters for your safety because sensation in your feet is your first defense against falls. If you cannot feel the floor perfectly, your risk of falling increases. For seniors, a fall is a major health event we want to avoid at all costs. If you are on this medication, I recommend asking your doctor specifically to check your B12 levels at your next blood draw. Do not wait for the tingling to start. If you are already feeling that tingling, do not assume it is just part of aging or unavoidable nerve damage. It might be a simple vitamin deficiency that is completely reversible. Also, a brief safety note here. If you use insulin or glucose-lowering medication, always keep checking your readings as you make changes to your diet or routine. When you fix a B12 deficiency and your energy comes back, you might move more, which can naturally lower your blood sugar. You want to make sure you are staying in a safe range as your health improves. The third reason you might be taking B12 the wrong way comes down to the chemical form of the vitamin itself. Not all B12 is created equal, and some forms are much harder for a senior body to utilize than others. Let's look at the case of James. James was 75 and he prided himself on being very thrifty and practical. He didn't like spending unnecessary money, so he bought the largest, most economical bottle of multivitamins he could find at the warehouse club. He had been taking them for years. James came in because he felt his memory was slipping. He described a brain fog where he would walk into a room and forget why he was there or struggle to find the right word in a conversation. He was worried about dementia. He pointed to his multivitamin and said, "I take my vitamins, so I know it's not nutrition." The mistake James made was assuming that all ingredients are the same. When we looked at his bottle, the form of B12 listed on the back was cyanocobalamin. This is a synthetic form of the vitamin. It is very cheap to produce and very stable on the shelf, which is why it is found in almost all bargain multivitamins. However, for your body to use cyanocobalamin, it has to go through a complex conversion process in the liver. It has to remove the cyanide molecule. Yes, it is a tiny amount of cyanide, harmless in small doses, but still requires processing, and then convert the B12 into an active form. As we age, our liver function naturally slows down. On top of that, a significant percentage of the population has a genetic variation known as MTHFR, which makes this conversion process extremely inefficient. James was essentially flooding his system with a raw material that his body was struggling to process into fuel. The change we made was switching James to a specific form called methylcobalamin. You can hear the difference in the name. Methylcobalamin is the form of B12 that already exists in nature. It is premethylated, which simply means it is ready for your body to use the moment it hits your bloodstream. It does not require the liver to do heavy lifting to convert it. After switching to this active form, James noticed that the fog began to lift. He felt sharper. His word recall improved. It wasn't that he had dementia. It was that his brain cells were not getting the active B12 they needed to maintain the myelin sheaths, which are the protective coatings around your nerves and brain cells. This connects deeply to your blood pressure and heart health through a compound called homocysteine. I will explain this simply. When your body properly processes B12, it keeps levels of homocysteine low. If you cannot process the B12 because it is the wrong form, homocysteine levels can rise. High homocysteine irritates the lining of your blood vessels, making them stiffer and more prone to plaque buildup. This stiffness keeps blood pressure higher. So, by choosing the right form of B12, James wasn't just clearing his brain fog, he was also protecting his arteries from irritation. Here is how you can do this. I want you to go to your cabinet and pick up your B12 bottle, put on your reading glasses, and look at the supplement facts panel on the back. Look for the word cobalamin. If it says cyanocobalamin, you are taking the synthetic form. For most people over 60, I recommend looking for a bottle that specifically says methylcobalamin. It might cost a few dollars more, but the difference in absorption and utilization by your body is worth it. You want the version that your body recognizes immediately, not the one that gives your liver extra work to do. This is especially true if you ever feel sluggish or toxic after taking standard vitamins. Your body might just be telling you it is struggling with the conversion. Switch to the active form and see if you notice the difference in your mental clarity. Number 4. This point is about understanding your lab results because the normal range on a piece of paper can be very misleading for a senior. I want to introduce you to Martha. Martha was 70 years old and had been dealing with some unsteadiness and low mood. She had done the responsible thing and gone to her general practitioner for a full blood panel. When the results came back, she was told everything was normal. She brought the results to me, feeling very discouraged. She said, "Dr. Harris, if my blood work is normal, why do I feel so terrible? Is it just in my head?" The mistake here was accepting the standard reference range without context. When we looked at her B12 number, it was around 250 picograms per milliliter. In the United States, the standard reference range often goes as low as 200, so technically at 250, she was in range. However, in countries like Japan and in many integrative medical practices, the lower limit is considered to be 500. They recognize that neurological symptoms, the brain fog, the mood dips, the balance issues, can begin when levels drop below 500, long before they hit that official bottom of 200. Martha was in the gray zone. She wasn't low enough to have anemia, but she was definitely low enough to have neurological symptoms. Her brain was effectively running on empty, even though the lab report said she was fine. The change we made was treating her symptoms and her optimal levels, not just the lab average. We started supplementation to push her levels up above 600. The improvement in Martha was wonderful to see. Her mood lifted because B12 is essential for producing serotonin and dopamine, the chemicals in your brain that regulate mood. Her balance improved because her nerves were getting the signal support they needed. This connects to your blood pressure through the stress response. When you feel unsteady, confused, or depressed, your body is in a state of low-level chronic stress. This releases cortisol. Cortisol clamps down on your blood vessels and raises your blood pressure. It is a survival mechanism. By optimizing her B12 and resolving those distressing symptoms, Martha's body could relax. Her stress hormones lowered, and that supported steadier blood pressure readings. Here is the simple explanation for you. Do not be satisfied with being at the very bottom of the normal bucket. You want to be in the top half of the class. When you get your blood work done, ask for a copy of the numbers. Do not just wait for the phone call saying everything is fine. Look at the B12 number yourself. If your number is below 400 or 500 and you are experiencing fatigue or memory issues, talk to your doctor about supplementation. You can explain that you want to be in the optimal range for neurological health, not just the survival range to prevent anemia. Most older adults can safely aim for a level between 600 and 800. B12 is a water-soluble vitamin, which means it is generally very safe. If you take a little too much, your body simply flushes the excess out through your urine. It is much safer to be slightly high than to be slightly low and risk nerve damage. So, take ownership of your numbers. Just like you know your blood pressure numbers, you should know your B12 number. It is a vital statistic for your independence and your cognitive health as you age. Another helpful step is to pair this awareness with your blood sugar management. If you are diabetic, your kidneys work harder to clear sugar, and you might lose more water-soluble vitamins like B12 in your urine. This makes checking your levels even more important. If you see your B12 dropping year after year, even if it is still normal, that is a trend you want to reverse before it becomes a problem. By fixing the form, the delivery method, the interaction with your meds, and your understanding of the levels, you are building a foundation for a much stronger nervous system. But we are not done yet. There are other critical factors involving what you eat and what you take with your B12 that can make or break your success. We need to talk about the partners that B12 needs to work. Taking B12 entirely by itself is often a mistake because it works in a team. If the other team members are missing, the work does not get done and your blood pressure can suffer for it. I also want to address the meat myth. Many seniors believe that because they eat chicken or beef, they cannot possibly be deficient. This is a dangerous assumption that leaves many people vulnerable to health decline. We need to break down exactly why food sources often fail us after the age of 60 and what you can do about it without changing your entire diet. Understanding the specific timing of when you take your supplement can also change how well it works. There is a specific window of the day that is best for your stomach and your energy cycles. If you are finding these first 4 steps helpful, I would appreciate you subscribing to the channel. It helps me continue to bring you these deep dives into senior health. The 5th mistake involves thinking that vitamin B12 works alone. It does not. It is part of a very specific team, and if the other team members are missing, your heart and your blood pressure pay the price. I want to share the story of Robert. Robert was 74 years old, and he was the kind of patient doctors love to have. He was diligent, he tracked his numbers, and he took his medication on time. However, he was incredibly frustrated because his blood pressure remained stubborn. Despite losing 10 pounds and cutting back on salt, his top number, systolic pressure, would not drop below 150. Robert came to me feeling defeated. He said, "I am doing everything right, but my body isn't listening." We looked at his blood work and specifically at a marker called homocysteine. His levels were dangerously high. The mistake Robert made was treating his blood pressure purely as a plumbing problem, pipes and fluid, rather than a chemical problem. You see, vitamin B12 has a primary job in the body. It recycles homocysteine. Homocysteine is a natural amino acid produced when you break down protein. In a healthy body, B12, along with folate, vitamin B9, and vitamin B6, breaks homocysteine down and turns it into helpful compounds like glutathione, which is an antioxidant. But Robert was taking B12 by itself, and his diet was low in leafy greens, so he lacked folate. Without the full triad, B12, folate, and B6, the recycling process stopped. The homocysteine built up in his blood. Why does this matter for blood pressure? High levels of homocysteine act like sandpaper on the inside of your arteries. It scratches and irritates the delicate lining of your blood vessels. When the vessel is irritated, it cannot relax. It stays stiff and inflamed. And as we know, a stiff artery is a high-pressure artery. Robert's blood pressure wasn't staying high because of salt. It was staying high because his arteries were chemically inflamed. The change we made was simple but targeted. We switched him to a B complex that included methylated B12, methylated folate, and B6, specifically the P5P form. We reintroduced the team members he was missing. Within 2 months, his homocysteine levels dropped by half. And what happened to his blood pressure? It finally started to respond to his other efforts. That stubborn 150 dropped down to 135. The sandpaper was gone, so his arteries could finally heal and relax. This is a longer-term lever. It is not an overnight fix, but it is a powerful one. Here is the simple explanation for you. If you are taking B12 for your energy, check to see if you are getting enough folate and B6 as well. They are the cleanup crew that protects your heart. However, a quick word of caution here, you do not need massive megadoses of B6. Too much B6 can actually cause nerve issues, which is ironic since we are trying to fix them. You want a balanced B complex, not an extreme dose of just one. So look at your supplement bottle again. Does it include folate or 5-MTHF? Does it include B6? If it does, you are likely covering your bases against this hidden inflammatory chemical. This supports steadier readings over the long haul because you are preserving the elasticity of your blood vessels. Number 6. This next point is one I have to have a conversation about almost every single day. It is what I call the meat myth. It is the belief that simply eating animal protein is enough to protect you from deficiency. Let's talk about Eleanor. Eleanor was 79, a wonderful woman who loved to cook traditional meals. When I mentioned B12 to her, she waved her hand and said, "Oh, Dr. Harris, I don't need pills. I eat beef stew, I eat roast chicken, I eat fish, I eat plenty of meat." Eleanor was suffering from weakness in her legs. She found it hard to get up from a low chair. She assumed it was just old age muscle loss. The mistake Eleanor made was assuming that eating the nutrient is the same as absorbing the nutrient. We touched on this earlier with stomach acid, but it goes deeper here. In animal foods, like beef, lamb, poultry, or fish, the vitamin B12 is tightly bound to the animal protein. It is locked inside the meat fibers. To unlock it, your stomach must produce a very strong enzyme called pepsin, along with hydrochloric acid. But here is the reality of aging. The cells that produce pepsin die off or become sluggish as we get older. You can chew that high-quality meat perfectly, but if your stomach cannot chemically cut the B12 away from the protein, it stays locked in the food. It travels through your digestion and leaves your body, never entering your blood. Eleanor was eating a diet rich in B12, but she was starving for it on a cellular level. Her leg weakness was a sign that her nerves were not firing correctly to her muscles. The change we made was difficult for her mentally because she prided herself on not needing medicine. I explained to her that a supplement in this case isn't medicine, it is just a different delivery vehicle. We added a supplement that was already free, not bound to protein, so her stomach didn't have to work to unlock it. Slowly, her strength returned. She wasn't just losing muscle, she was losing the nerve signal to the muscle. Once the signal was restored, her mobility improved. This connects to your blood sugar management as well. Protein is essential for stabilizing blood sugar. We want you eating those high-quality proteins, but if you are relying only on that food for your B12, you are likely falling short. Here is the simple explanation. If you are over 60, consider food-bound B12 to be a bonus, not your primary source. Due to the changes in your stomach lining, you cannot count on food the way you could when you were 30. The action step here is to let go of the guilt or the feeling that you should be able to get everything from food. Modern agricultural soils are depleted, and senior digestion is different. Taking a small supplement ensures you get what you need without having to eat massive quantities of food that might spike your blood sugar or upset your digestion. One more easy change is to look for fortified foods, like certain nutritional yeasts or plant milks, which often contain the free form of B12 that is easier to absorb than the form found in heavy meats. But again, a supplement is the surest safety net. If you are finding this helpful, please take a second to subscribe to the channel. It really helps us reach more seniors who need this information. The seventh point is a safety-critical issue that links B12 directly to a condition that causes many falls in older adults. It is about your autonomic nervous system, the automatic control system that manages your blood pressure when you move. I want to tell you about Henry. Henry was 78. He came to me because he was scared of falling. Every time he stood up from his recliner to go to the kitchen, he would get a wave of dizziness. The room would spin for a few seconds. He had actually fallen once because of it. His previous doctor had lowered his blood pressure medication, thinking the drugs were too strong and pushing his pressure too low. But even on a lower dose, the dizziness continued. Henry was becoming afraid to move. The mistake here was missing the root cause. Henry didn't just have low blood pressure. He had orthostatic hypotension caused by B12 deficiency. Let me explain this connection. Your autonomic nervous system controls the constriction of your blood vessels. When you stand up, gravity pulls your blood down toward your legs. Instantly, your nerves should send a signal to your leg vessels to squeeze tight, pushing blood back up to your brain so you don't faint. B12 is the fuel for those nerves. When Henry was deficient, his nerves were sluggish. He would stand up, gravity would pull the blood down, but the squeeze signal was too slow. His brain was momentarily starved of oxygen, causing the dizziness. It was a nerve failure, not a medication failure. The change we made was aggressive B12 replacement to heal the autonomic nerves. We also taught him a specific way to check his blood pressure to monitor this. Here is how you can do this at home. This is a vital skill for every senior. You need to check your blood pressure twice to see if this is happening to you. First, sit down and relax for 5 minutes. Take your blood pressure and write it down. Let's say it is 130/80. Next, stand up. Wait 1 minute while standing, and take your blood pressure again while standing. Keep the cuff at heart level. In a healthy person, the numbers should stay about the same or drop very slightly. In Henry's case, his top number dropped from 130 down to 100 just by standing up. That is a massive drop. That is why he was dizzy. After 3 months of correcting his B12 levels, his nerves healed enough to send that signal faster. The drop became much smaller, and the dizziness went away. He could stand up with confidence again. This supports steadier readings because it stabilizes the volatility of your pressure. Wide swings in pressure, going from high to very low, are dangerous. If you ever feel dizzy upon standing, do not ignore it. Do not just assume you stood up too fast. Check your B12. Your automatic system might be running low on fuel. Who should be cautious here? If you find a big drop when you stand, more than 20 points, be very careful with hot showers or getting out of bed in the morning. Sit on the edge of the bed for a minute before standing to give your slow nerves time to catch up. The final piece of the puzzle is the habit stack. This is where we talk about the sequence and timing, because even the best supplement fails if it clashes with your body's natural rhythms. Let's look at Beatrice. Beatrice was 82, sharp as a tack, but she struggled with sleep. She was also taking her B12 faithfully right before bed. She kept her pills on her nightstand and took them with a sip of water before turning out the light. The mistake Beatrice made was fighting her own biology. Vitamin B12 is a natural energy booster. It plays a key role in cellular metabolism, literally how your cells create energy. When you take it at night, you are sending a signal to your brain that it is time to be awake and active. It can suppress melatonin, the sleep hormone. Beatrice was wiring herself tired. She would lie in bed, unable to drift off, which then raised her stress levels and her morning blood pressure. The change we made was shifting her B12 intake to the morning, right after breakfast. The result was twofold. First, she had more energy during the morning when she needed it for her house chores. Second, her sleep improved because the stimulating effect had worn off by bedtime. Better sleep means better blood pressure control. Sleep is when your cardiovascular system resets. Here is the exact protocol I recommend for the best absorption and effect. Take your B12 in the morning. If it is a sublingual, under the tongue, do it before you brush your teeth or drink your coffee. Let it dissolve while you are getting your clothes ready. A clean mouth allows for good absorption. If it is a capsule, methylated B12 with B complex, take it with your breakfast. B vitamins utilize the acid that is present when you eat to help with digestion, even if we are bypassing the main absorption issue with the form. And here is the same-day lever to add to this habit. Drink a full glass of water with it. Hydration is the quickest way to support your blood pressure. When you are dehydrated, your blood volume drops and your body clamps down your vessels to compensate, driving pressure up. Older adults often lose the thirst signal. By anchoring your water intake to your morning vitamin, you guarantee yourself a hydration win to start the day. Beatrice found that simply moving the pill from night to morning gave her better rest and better energy. It is a tiny change with a big impact. This is easy on the joints because it requires no extra effort, just a change in timing. Number 9. We need to discuss a hidden danger that is sitting in your pantry right now, which is actively hiding your vitamin B12 deficiency from your doctor. This is what I call the fortification trap, and it is one of the main reasons seniors suffer from nerve damage even when their blood tests look confusingly optimistic. I want to share the story of Thomas. Thomas was 76 years old, and he was a man who loved his morning routine. Every single day for 40 years, he had a bowl of bran flakes and 2 slices of toast. He believed, and rightly so, that he was getting plenty of fiber. However, Thomas began to experience that dangerous unsteadiness we talked about earlier. He was stumbling in his hallway. His hands were shaking when he tried to sign checks. When Thomas went for his standard checkup, his doctor looked for anemia. Usually when B12 is low, your red blood cells become huge and misshapen, a condition called macrocytic anemia. This is the red flag doctors look for, but Thomas's red blood cells looked perfect. His doctor ruled out B12 deficiency because there was no anemia, and sent him to a neurologist to look for Parkinson's or a stroke. The mistake here was the food, not the doctor. In many countries, flour and cereals are fortified with something called folic acid, synthetic vitamin B9. This was done to prevent birth defects in pregnant women, which is a noble goal. However, for a senior like Thomas, high intake of folic acid can fix the anemia caused by low B12, but it does not fix the nerve damage. Essentially, the toast and cereal were masking the warning sign. The folic acid cured the blood problem, leaving the nerve problem to rot in the background. Thomas's nervous system was degenerating, but his blood work looked pristine because the fortified food was painting a false picture. This is known as masking, and it is a major reason why B12 deficiency is missed in the elderly until it is too late. The change we made was looking beyond the red blood cell count. We ran a specific test called methylmalonic acid, MMA. When B12 is low, MMA spikes high. It is the gold standard because folic acid cannot hide it. Thomas's MMA levels were through the roof. We immediately started him on B12 therapy, not folic acid. The improvement took time because nerve healing is slow, but the shaking in his hands stabilized. He didn't have Parkinson's, he had a masked deficiency. This connects directly to your blood sugar and blood pressure through the inflammatory response. When your nerves are dying, your body is in a state of high inflammation. Inflammation causes insulin resistance, making blood sugar worse, and stiffens arteries, making blood pressure worse. By unmasking the real problem, we stopped the systemic fire that was burning in his background. Here is the simple explanation for you. If you eat a lot of bread, pasta, or breakfast cereals, you are getting a lot of synthetic folic acid. Do not assume you are safe just because your routine blood count, CBC, is normal. If you have balance issues, numbness, or memory slips, ask your doctor specifically for the MMA test or the methylmalonic acid test. Tell them, I eat fortified foods, and I want to make sure my B12 deficiency isn't being masked. This is a critical safety step. Do not let a normal blood count give you a false sense of security while your nerves are crying out for help. Number 10. This next point is the sugar drain. If you are watching this channel, you likely care about your blood sugar, but you probably don't realize that high blood sugar acts like a vacuum cleaner, sucking vitamin B12 and other B vitamins right out of your body. Let's look at the case of Linda. Linda was 65 and pre-diabetic. She wasn't on medication yet, but her fasting glucose was usually around 110 or 115. She had a sweet tooth and would often have a piece of cake or sweet tea in the afternoon to keep her energy up. She came to me complaining of exhaustion. She said, "Dr. Ben, I eat sugar for energy, but an hour later I feel like I've been hit by a truck." The mistake Linda made was not understanding the cost of processing sugar. Every single gram of glucose you eat requires a team of enzymes to burn it into energy. These enzymes are fueled by B vitamins, specifically B1, thiamine, B12, and magnesium. When Linda ate the sugar, her body had to raid its own vault of B vitamins to process that sugar spike. Because she was doing this daily, she was constantly depleting her reserves. She was burning through her B12 faster than she could replace it. The crash she felt wasn't just a sugar crash, it was a nutrient depletion crash. Her cellular engines were stalling because she had used up all the oil. The change we made was twofold. We obviously worked on reducing the refined sugar, but we also supplemented her with a B complex to refill the vault. The result was that her cravings actually went down. Often you crave sugar because your cells are starving for energy. Once we restored the B vitamins, her cells could produce energy efficiently from healthy fats and proteins, and she stopped looking for the quick fix of sugar. This connects to your blood pressure in a massive way. High insulin levels caused by sugar tell your kidneys to hold on to sodium. When you hold on to sodium, you hold on to water, and your blood pressure goes up. By breaking this cycle of sugar eating and vitamin depleting, Linda lowered her insulin, flushed out the excess water, and saw her blood pressure drop by 8 points. Here is the simple explanation. If you have high blood sugar, you need more B12 than the average person, not the same amount. Your metabolic engine is running hot and using more fuel. One helpful step is to think of B12 as your protection against the damage of glucose. If you indulge in a carbohydrate-heavy meal, do not skip your vitamins the next morning. Your body has just done a marathon of processing, and it needs recovery support. Comment down below, do you notice that you feel more tired after a sweet meal? That is often the sign of this depletion happening in real time. Number 11. We cannot talk about blood pressure and B12 without talking about the ignition switch. This is the mineral magnesium. You can take all the B12 in the world, but if you are magnesium deficient, and 70% of seniors are, that B12 cannot do its final job. I want to introduce you to Samuel. Samuel was 80 years old. He had high blood pressure and suffered from terrible leg cramps at night. He was taking his blood pressure meds and his B12, but nothing seemed to resolve the cramps or the stubborn pressure readings. The mistake Samuel made was missing the cofactor. Vitamin B12 requires magnesium to be metabolized properly by the cells. Furthermore, magnesium is the primary mineral that allows your blood vessels to relax. Without magnesium, arteries stay tight, high BP. Without magnesium, muscles stay tight, cramps. Samuel was pouring B12 into a system that was locked up. The change we made was adding a specific form of magnesium, magnesium glycinate, to his evening routine. We didn't change his B12, but we added the igniter. The improvement was almost immediate. Within 3 days, the leg cramps stopped. Within 2 weeks, his blood pressure lowered enough that we had to reduce his medication dose because he was getting too low. By unlocking the B12 with magnesium, we allowed his nervous system to calm down. This supports steadier readings because magnesium acts as a natural calcium channel blocker, which is exactly how many blood pressure medications work. Here is how to do it. If you are taking B12, you should almost certainly be taking magnesium, unless you have kidney failure. Always check with your doctor if you have advanced kidney disease. I recommend magnesium glycinate or taurate for seniors. Avoid magnesium oxide, which is cheap but poorly absorbed and mostly just causes loose stools. Take 200 to 400 milligrams in the evening. This pairs perfectly with the morning B12 routine we established in Part 1. Morning for energy, B12, evening for relaxation, magnesium. Number 12. This point is a specific safety warning for those of you who get B12 shots or injections from your doctor. This is the potassium drop, and it is something that sends seniors to the emergency room every year because nobody warned them. Let's talk about Margaret. Margaret was 71 and had severe pernicious anemia, meaning she could not absorb B12 from her stomach at all. Her doctor rightly prescribed monthly B12 injections. After her first shot, Margaret went home feeling happy that she was getting fixed, but 6 hours later, she felt her heart fluttering. She felt weak, shaky, and had palpitations. She thought she was having a heart attack. The mistake here was a lack of preparation. When you give a B12 deficient body a large dose, like a shot, the body gets excited. It immediately starts producing millions of new, healthy red blood cells. This is great, but to make a new cell, the body needs building blocks. One of the main building blocks is potassium. Margaret's body pulled all the potassium out of her blood to build these new cells. This caused her blood potassium levels to plummet, hypokalemia. Low potassium causes heart arrhythmias and palpitations. It wasn't a heart attack, it was a construction shortage. The fix for Margaret was simply knowledge. We instructed her to eat high potassium foods on the days leading up to and following her shot. She started eating avocados, spinach, and potatoes around her injection days. The result? The palpitations never happened again. She got the benefit of the B12 without the scare of the heart rhythm issue. This connects to your blood pressure because potassium is the direct counterbalance to sodium. If your potassium drops, your blood pressure often destabilizes. Here is the simple explanation. If you start a high-dose B12 supplement or get shots, you must increase your potassium intake. You do not necessarily need a potassium pill, which can be dangerous if dosed wrong. You need food. On the days you ramp up your B12, have a large salad, a baked potato with the skin, or an avocado. Give your body the bricks it needs to build the new house. Who should be cautious? If you are on water pills, diuretics for blood pressure, you are already losing potassium. Adding a B12 surge on top of that can be a double whammy. Be extra vigilant about your potassium foods. Number 13. This brings us to the gut garden. We established in Part 1 that stomach acid matters, but what about the bacteria in your intestines? I want to share the story of David. David was 69. He had a history of recurring infections and had taken antibiotics 3 or 4 times in the last 2 years. He was taking B12 supplements, but his levels remained stubbornly low. The mistake David made was underestimating his microbiome. We now know that healthy gut bacteria actually play a role in the production and absorption of B vitamins. Furthermore, if you have an overgrowth of bad bacteria in the small intestine, a condition called SIBO, those bad bacteria will actually steal your B12 before you can absorb it. They eat it first. David was feeding his supplement to his bad bacteria, not to himself. The change we made was a course of probiotics and prebiotic fibers to restore his gut flora. We had to weed the garden so the crop could grow. The improvement took a few months, but as his digestion settled, less bloating, more regularity, his B12 levels finally began to rise. This connects to blood sugar because the gut microbiome is a huge regulator of insulin sensitivity. A healthy gut helps manage blood sugar spikes. Here is the simple explanation. If you have taken antibiotics recently, or if you suffer from constant bloating and gas, your B12 deficiency might be a gut problem. One easy change is to add fermented foods to your diet, like sauerkraut or yogurt if you tolerate dairy, or take a high-quality probiotic designed for seniors. Bifidobacteria strains are usually good. Number 14. The final new point is the oxygen factor. This is about sleep apnea, a condition that destroys blood pressure control and is deeply linked to nerve health. Let's look at Albert. Albert was a large man, 75 years old, with a thick neck. He snored loudly. He had high blood pressure that was resistant, meaning 3 medications weren't fixing it. He also had numbness in his hands. The mistake was treating the symptoms separately. Albert had undiagnosed sleep apnea. He stopped breathing hundreds of times a night. This creates hypoxia, low oxygen. Nerves are extremely sensitive to low oxygen. You can take all the B12 you want, but if you choke your nerves of oxygen for 8 hours a night, they will die. Furthermore, every time he stopped breathing, his adrenaline spiked, keeping his blood pressure sky high. The change was getting him a CPAP machine to fix the breathing and optimizing his B12. The result was the most dramatic of all. His blood pressure dropped 20 points in a month. His nerve sensation returned because, for the first time in years, his nerves were getting both the fuel, B12, and the oxygen they needed to burn it. Here is the simple explanation. If you snore and have high blood pressure, you must get checked for sleep apnea. B12 cannot fix oxygen starvation. They must be treated together. Conclusion. We have covered an immense amount of ground today. We started with the simple reality that 40% of you are deficient, not because you aren't trying, but because the rules of your body have changed. We looked at the stomach acid trap and why sublinguals are superior. We exposed the Metformin interaction that mimics nerve damage. We swapped the synthetic cyanocobalamin for the active methylcobalamin. We learned to read your labs for optimal levels, not just normal ones. We connected the heart triad of B12, folate, and B6 to lower homocysteine. We debunked the meat myth and why digestion fails to extract what you eat. We solved the dizziness of orthostatic hypotension. We fixed your timing with the habit stack. We uncovered the folic acid masking that hides damage. We saw how sugar drains your reserves. We added the magnesium ignition and potassium safety. And we finally looked at the gut and oxygen connections. This is not just about a vitamin. This is about a philosophy of senior health. It is about understanding that your blood pressure and your blood sugar are not isolated numbers. They are the result of how well your body is fueled and how well your nerves are communicating. When you fix a B12 deficiency correctly, you aren't just preventing anemia. You are giving your nerves the coding they need to send clear signals. You are giving your heart the chemical environment it needs to relax. You are giving your brain the energy it needs to remember the names of your grandchildren and the location of your keys. You do not have to implement all 14 steps today. That would be overwhelming. I want you to pick the one that resonated most with you. Maybe it is checking your bottle for methylcobalamin. Maybe it is moving your pill to the morning. Maybe it is eating a potato before your next doctor's appointment. Start with one, master it, then add another. Health after 60 is not about being perfect. It is about being strategic. You have the knowledge now. You know more about B12 than most patients and, frankly, some providers. Use that knowledge to advocate for yourself. If you know someone over 50 who could benefit from this, share this video. You might be the person who stops their fall or clears their brain fog. And subscribe for more simple, science-backed blood pressure and blood sugar tips. I'm Dr. Ben Harris. Thank you for giving me your time, and I will see you in the next video.